And almost 2 years ago, COVID-19 became a name around the globe, and parents are still trying to figure out how they can talk to their children about the virus and the vaccine. Our Nixon Norman has more from one UAB expert.
Ever since the pandemic began, we've all had to put our lives on hold in one way or another. Now, sometimes this can look like skipping out on a fun event, and other times consequences can be far more detrimental, like when it comes to skipping out on healthcare.
I think just in general, everybody is behind on taking care of themselves medically. You know, it's very common for patients to come in for their annual visit and to have not been seen in, 2 years.
This delay in healthcare also translates to a delay in immunity. Because people are skipping out on their checkups, they're also skipping out on getting vaccinated against the flu, COVID, anything. And speaking of vaccination, COVID vaccines for young people, specifically age 5 to 11, were recently approved. For many parents, this is great news. But some don't know how to spark a conversation about the COVID-19 vaccine. One UAB pediatric expert says she breaks it down to her kids like this.
Letting them know that this is protecting them and our loved ones, acknowledging that, this is a shot. It's a poke in your arm, and it's not going to feel good. But it's a brief poke, and maybe a little bit of arm soreness afterwards. But then you're getting so much immunity and protection to be able to hopefully get out of these masks one day and be able to get back to life.
And before chatting with your young ones, Di suggests chatting with your pediatrician first.
I would just encourage parents to have a conversation with their pediatrician, with their trusted medical provider.
For more information about the COVID-19 vaccine from other trusted medical providers, head on over to fox54.com. Nixon Norman, Fox 54 News.